Hello class. Today we're going to be talking about some central nervous stimulants. The three that I'm going to be focusing on today will be Dexedrine, Adderall, and Ritalin. So first we'll talk about the disorders that these drugs are used to treat. And the first one would be attention deficit hyperactivity disorder, also known as ADHD. This disorder is categorized or defined as developmentally inappropriate patterns of inattentiveness, hyperactivity, and impulsivity. And the key word here is developmentally because this disorder is not usually diagnosed until a kid is older than 4 because it's kind of hard to diagnose kids under 4 because, kids are going to be hyperactive and also inattentive. This disorder is childhood onset. There's no such thing as adult onset ADHD, and it's not completely understood as far as the pathophysiology. The other disorder that central nervous system stimulants are available to treat is narcolepsy. And narcolepsy is a chronic neurological disorder, and it is categorized just by someone who sleeps a lot. Three of the top symptoms that are seen with narcolepsy are cataplexy, which is basically just a sudden loss of muscle tone, and you're usually awake, and it's triggered by strong emotions like laughter, stress, or anger. Another one is EDS, excessive daytime sleepiness, and you're just always just having a general lack of energy and sleepy. The next symptom that's also seen in narcolepsy is hypnagogic hallucinations, and just basically hallucinations that occur between the sleep and wake cycle. Okay, so these are the drugs that are used to treat ADHD and narcolepsy: Dexedrine, Adderall, and Ritalin. With the exception of narcolepsy, with CNS stimulants, narcolepsy also is treated with antidepressants. So now we're going to talk about the first drug out of our CNS stimulant drugs, and that is dextroamphetamine, also known as Dexedrine. And how this drug works is by releasing dopamine and norepinephrine. And why that works is because when you release dopamine and norepinephrine, it's increasing the amount there is in the brain and in the body. And dopamine and norepinephrine, when increased, helps with the activity portion of the brain. And that helps increase the focus and attention parts of the brain. And it also acts on the cerebral cortex and the RAS. And the RAS is the reticular activating system. That's the portion of the brain where goals are set, and it's also the portion of the brain where information is entered. And so you can understand why that would work well for someone who has ADHD, why focus would be necessary. This is a Schedule II controlled substance and highly addictive, chances for addiction, and it is metabolized by the liver, excreted in the urine, and it is PO, pill form. Okay, so some contraindications with Dexedrine are caution or contraindicated in patients with cardiovascular disease, hypertension, glaucoma, hyperthyroidism, a history of drug abuse, and MAOI therapy. Now, this drug is a sympathomimetic. And so that just, you can see why it makes sense why it would be a caution in patients who already have high blood pressure or cardiovascular disease, because it would just potentiate, exacerbate all those issues already. And a history of drug abuse, we did say this drug is a Schedule II controlled substance, so there's already an addiction potential. So it wouldn't be wise to give this drug to someone who already abuses drugs. And in patients with MAOI therapy, it's important to wait 14 days after DCing MAOI therapy to give this drug, because patients could be at risk for a hypertensive crisis. And in Tourette syndrome, stimulants will exacerbate motor disorders. So caution with that. And this is a pregnancy category C drug. Okay, now we're going to talk about Ritalin, also known as methylphenidate. And this drug works just like Dexedrine. The only difference is that it has a milder central nervous system effect than amphetamines do. And it affects the mental more than it affects motor activities. This is a first choice drug for ADHD because it's very easy to individualize the drug, and it has a quick onset, and there's also some forms where it can work all day, which is great for children. And the route is PO. It also comes in pill form, tablet form, and it is a Schedule II controlled substance. Now, it's important to understand that this drug, Ritalin, interacts with antihypertensives and anticonvulsants and certain antidepressants. In antihypertensives, it will decrease the effects. So it's important not to mix those two drugs. And with anticonvulsants and antidepressants like TCAs, tricyclics, and SSRIs, it will increase the effects of those drugs. So, and of course, with our MAOIs, it will cause hypertensive crisis. So some common adverse effects would be restlessness, insomnia, tachycardia, anorexia, weight loss, tolerance, dependence, hypertension, nausea, vomiting, and psychiatric symptoms. And some more major symptoms that would come with this, taking these drugs, is strokes. You can be at risk for a myocardial infarction and even death. Now, a huge black box warning with this is that patients who take this are they have a high chance of becoming dependent on it. And it's not uncommon for patients to redistribute the medications and sell them to people to help, because this does help you stay productive. So a lot of people are willing to buy it out on the street. So just as a nurse, to be aware of that and to use your best judgment. Okay, now for some patient teaching and care implications, both for Dexedrine and Ritalin. Some things to note is when patients take these drugs, to make sure that they take the drug with food, because one of the side effects is that it can cause nausea, anorexia, and weight loss. And so when you take it with food, chances are they won't get nauseous until later on, maybe 30 minutes after the drug, and that's well after they've eaten. and less chances of them becoming not wanting to eat anorexia, and of course, less chances of them having to lose excessive amount of weight. Something else to remember is that it's a good idea, good practice to have the patient take this medication in the morning, but if not in the morning, at least, especially in the morning with sustained release, but definitely don't take this medication more than 6 hours before bedtime, just because one of the side effects is insomnia, and just to make sure that they don't have that effect, that they are able to get their rest, just try not to administer this medication more than 6 hours before bed. Another patient teaching point is that amphetamines will appear when they have drug screenings. So just for them to let their employer know before they go and get such a test done. And last but not least, the most important thing is to make sure that since tolerance is easy to build up with this drug, to take drug holidays. And maybe for kids, if kids are taking this drug, maybe in the summer when they're not needing to be as focused and study, maybe they can take a drug holiday at that time. Just making sure that they check in with their doctor and see what their doctor says during the course of the treatment. All right, that is all with learning about Ritalin and Adderall and Dexedrine. Thank you guys for listening. Hope you learned something. Okay, and these are my sources.